Okay, welcome to class everyone. Please grab a hold of your ball. Before we start, I want you to make sure that you know that it doesn't really matter what ball you have. If you have a therapy ball like the ones I gave you, that's wonderful, that would be ideal. If, however, you have a sponge ball like this, I'm using this just so that you can see it more clearly on camera. Or if you use a balled up ball of socks, that's totally fine too. It doesn't really matter. Now, someone asked me a very interesting question just before we got started today. They said that when we do this type of ball work, is it okay if I do other things, like watch Netflix or listen to French lessons, or do I have to be really present when you do this? And my answer was yes. Yes to both, obviously. Ideally, we do this as often as we can, and if that means doing other things while we do it, totally fine. However, on occasion, I would really like you to make a concerted effort and check in, right? Just like when you're breathing, when you breathe, it's really nice to pay attention and be aware of what's happening, but at the same time, you don't need to really be that aware all the time. I think that's very counterproductive. We don't need to do that, okay? So please, in the context of these videos, pay attention, always be aware, don't bruise, don't hurt, but at the same time, feel free to do this, quote unquote, mindlessly, so that you're more likely to do it more often, okay? Ball away for now, hands on the floor. Take a deep breath, inhale, and a deep breath, exhale. This will be easier for some, harder for others, depending upon how often you've been practicing. Allow yourself, please, to press into the floor very firmly, like literally press into the floor. Slight flexion in the elbows, inhale and exhale. Inhale and exhale. As you press into the floor, draw those elbows back, lengthen through that spine. Thank you. Inhale, belly toward the floor. Exhale, belly away from the floor. Inhale, belly down. Exhale, belly up. Moving at the belly, please. Inhale, lower. And exhale, lift. Inhale, lower. Exhale, lift. Inhale, lower. And exhale, lift. Thank you. 5, lower and lift. 4, lower and lift. 3, lower and lift. 2, lower and lift. And relax, please. Thank you so much. Keep that pressure up with the hands. Gently lengthen back through this left leg. Inhale and exhale and lift up through that right knee. Thank you so much. Keep your hips nice and stable. Big breath in and a big breath out. You're welcome to stay, but you're also welcome to draw that right knee forward and draw it back. Inhale and exhale. Inhale and exhale for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you. Gently switch. Draw this left knee forward. Big breath in and a big breath out. Press into those hands once again. Feel like you're very neutral with this pelvis here. Thank you. Gently lift that left knee back and forth. Inhale and exhale for 10. Notice the only movement is in my hip and my leg. I'm not tilting my back or anything. 7, 6, 5, 4, 3, 2, 1. Curl the toes, please. Lower the knees. Wonderful. Allow yourself to gently take those fingertips and turn them outwards just a little bit. Feel like you're pushing one hand one way, pushing the other hand the other way. Thank you. Inhale and exhale. Inhale and exhale. Once you're there, neutralize the pelvis, lift up the hips, hold the knees up. Thank you. While you're holding those knees up, we'll breathe for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you. Lengthen back through this left leg, lengthen back through the right leg. Keep pressing the hands apart and hold here in plank again. Maybe lift up through the heels, finding just the toes, and really make a concerted effort to feel like your hands are moving away from each other on the floor. Feel like you're pressing outwards. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And gently lower, please. Thank you. Turn the fingertips inwards, 1 and 2. And this time squeeze the hands toward each other. As you squeeze those hands toward each other, lengthen through the arms, lift through the knees, and hold. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you. Keep pressing, lengthen long through the legs. Squeeze together and hold. You don't have to come down. Nope. Just keep squeezing the hands, fingertips together. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you, everyone. Place that right hand on the floor. Good. Left hand like so. And go ahead now and start to circle through this right wrist. So this right wrist is circling for 5, 4, 3, 2, and 1. Other direction. 5, 4, 3, 2, and 1. Thank you. Grab hold of that right wrist with your left hand. Add a bit more body weight. So you're using your left arm as well as the rest of your body to press down. And now circle through that wrist, feeling that stretch, extension and flexion through that wrist. 5, 4, 3, 2, and 1. Other direction, please circle. 5, 4, 3, 2, and 1. Now we do this exercise quite a bit with our feet. We don't usually do it with our hands, but today we are. Take that ball, please, across here, the knuckles. Press down and let the wrist fall toward the floor. Awesome. Inhale and exhale. Go ahead and rock forward a little bit. And feel that considerable stretch there on your hand and wrist. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Release. Take, please, the ball to the heel of the wrist. The knuckles are traveling toward the floor. Press down. Good. And rock forward a little bit, rock back a little bit. Feel like you're getting a good bit of stretch. Thank you. 7, 6, 5, 4, 3, 2, 1, and release. Go ahead and relax your hand. Beautiful work. Thank you for using the ball with me. Second side. Take that hand, please, to the floor. Go ahead now and start to circle through that wrist, adding some pressure, adding some weight. Inhale and exhale. You're feeling it right here. Inhale and exhale. 5, 4, 3, 2, and 1. Other direction, please. Circle. 7, 6, 5, 4, 3, 2, 1. Grab hold of your right hand, please. Press down into that left. Good. Go ahead now. Circle again. 7, 6, 5, 4, 3, 2, and 1. Other direction. 7, 6, 5, 4, 3, 2, 1. Perfect, everyone. And gently release. Ball, once again, across the knuckles or the back of that, in the palm there, across the knuckles. Press that wrist downwards. So you can see my hand here is that extension. And now I'm going to add pressure and rock forward into it. I can rock forward and back to ask it to release. 7, 6, 5, 4, 3, 2, 1. Thank you. Go ahead, take that hand into the ball, press down. Right there. Big breath in and a big breath out. Thank you. 7, 6, 5, 4, 3, 2, 1. Amazing, everyone. Perfect. Let's go ahead and lay down and move that work into our arms a little bit, okay? Take that right elbow on top of the ball, and you'll feel this nice tricep stretch. Big breath in, big breath out. Go ahead and drop the chest, relax forward. Inhale and exhale, releasing through that right hand. Beautiful. 10, 9, 8, 7. So my body weight is going into it. I feel it there. 7, 6, 5, 4, 3, 2. Very similar. I'm going to allow myself to rotate my right hand now downward so that the palm is down. I'm going to look forward and I'm going to feel that stretch through my shoulder. Inhale and exhale. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I'm going to turn so that you can see maybe a little bit better. So previously it was here. Then we saw it here. And now we're going to take the ball here and turn the hand outwards and fold and stretch. Oh. Relax into that right hand. Feel that folding, stretching sensation. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And release, please. Thank you. Second side. Allow this left elbow to come down. Reaching forward to that elbow, drop through the chest. Feel that ball. Oh. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Drop down. Fold into it. Feel some stretch here. Inhale and exhale. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Beautiful. Rotating outwards. Feel that stretch. There. Big breath in. Big breath out. Lovely. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Awesome, everyone. And gently, easily release. Come on up. We're going to slide this ball just underneath our left shoulder into the left latissimus dorsi. So the ball comes right here into our left underarm. So there's tricep, and then it merges, and then your lat just below the shoulder. That's where the ball is going to go. So go ahead and lay on your side and take that ball right into your left lat. Ooh. Big breath in, big breath out. You should be able to see it fairly clearly on me. That's why I'm using such a comically large ball in some ways. Big breath in, big breath out. Now, obviously, it's not going to feel wonderful as it is. Don't worry about it. Let it be there. Inhale and exhale. Breathe through. 10, 9, 8, 7, 6, 5. If you'd like a little bit more, you can extend long through that right hand. Therefore, there'll be more weight in line here and pressing down. If you'd like a little bit more than that, lift up that left elbow. Oh. Hold here for 10, 9, 8, 7, 6, 5. Finally, if you'd like to, this one's kind of nice. Draw this left arm long so you feel this pre-tensioning through the arm. Relax the head down. Oh. And just get into that left latissimus dorsi for 5, 4, 3, 2, 1. Gently lift the head, maybe bend the elbow, let your head rest into the hand, and just keep that work into that left side of your body just below the shoulder. Ooh. There'll be lots of tight, interesting places to work on. Inhale and exhale and relax. And to go back to that question about should I be doing something else, if you're able to remind yourself to relax while you're doing something else, awesome. However, especially at the beginning, I find that people really need to focus on relaxing, otherwise you're just going to get tighter. And that's the instinct, right? Ooh, it hurts a little bit, so I'm going to get tighter. That's not what we want to develop by way of habit. What we want to do is get into the habit of relaxing into this. Inhale and exhale. Inhale and exhale. Thank you. Slowly up. And I'd like you to maybe slide that ball into a second location, just underneath that left arm. Somewhere maybe a little bit lower or a little bit higher. The point is that there's lots of places. There are many places for you to go. Just find another one. Ta-da. And there we go. You can go up, you can go down, you can go forward, you can go back. Just make sure that it's an interesting spot. By interesting, again, we mean that there's work being done. Your capacity to feel it, and then your capacity to relax into it is what's being worked on. Big breath in, big breath out. I really like kind of just rocking around into it there. I'm not meaning to suffer. I'm not meaning to find pain. I'm finding challenge for sure. But again, I'm just hoping that you'll be able to relax. Big breath in, big breath out. Beautiful. Beautiful. 7, 6, 5, 4, 3, 2, and 1. And as usual, I'll sit up, and maybe along this background you'll be able to see. Typically my shoulder that I was treating is lower than the shoulder. Can you see it? I don't know. If you can see it, great. If not, don't worry about it. Typically this shoulder is lower than this shoulder after that work. Okay, take note of where my shoulder height is, and then let's go to that second side. So go ahead and find that ball underneath that right arm at the right latissimus dorsi. Thank you. We're gonna hang out here. Big breath in, big breath out. 10, 9, 8, 7, 6, 5. If it's appropriate for you, lift up through this left arm. Maybe even lift up through this right elbow. For 10, 9, 8, 7, 6, 5. Others may want to lengthen through this right arm, lower down. Oh yeah. Feel that strong work there. For 5, 4, 3, 2, and 1. Thank you. Gently lift the head, bend the elbow, and just relax into it. Big breath in, big breath out. So if you're getting to a place where it's very nervy and raw, that's too much. It's probably leaving a bruise. It'll probably feel like it's damaging. That's not it. It should be challenging. It might be a little bit sore. You know, I find I get very annoyed when I go to a therapeutic massage. I'm not talking spa or anything, but a therapeutic massage or therapy, and nothing happens. It feels like somebody's rubbing oil on me. I don't want you to have that sensation here. I want you to feel like work is being done, that you're actually challenging and then meeting the challenge. Got it? Thank you. 7, 6, 5, 4, 3, 2, 1. Gently lift and find a second location underneath that right shoulder blade, somewhere along the right latissimus dorsi up here. You can take it down, you can take it up, you can take it forward, you can take it back, just somewhere else. There we go. For me, yeah, that's somewhere interesting. I'm going to just relax my head into it, and I'm going to maybe rock forward and back. I'm going to allow myself to be curious. I'm going to allow myself to feel like I can get enough out of this. Inhale and exhale. Inhale and exhale, please. Thank you so very much. Big breath in and a big breath out. Relax your face, relax your jaw, perhaps for another 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. And slowly press on up. Yes. Inhale and exhale. So as we sit, as we recover, maybe you'll see my shoulders have changed a little bit, hopefully. Great. If it hasn't, don't worry about it. Now, I said this is not ideal because this is a very soft, spongy ball, but it's really big so you can see it. I prefer to have just the right sort of texture. If it's too hard, it's bad. So no golf balls, no lacrosse balls, no hard baseballs. But at the same time, something that's really mushy is going to be beneficial. And then sometimes people ask me, should I have the spiky one or should I have the gel one? Whatever is comfortable for you. The spiky ones they're okay. You know, the gel ones are okay. To me, it's the hardness that matters the most. So find something that you can be challenged with, but you can still sink into. Awesome, everyone. Thank you very much. We're going to move now into the back of the body. I'd like you to please consider your neck. So previously we were at the right shoulder. I'd like you to think of the base of the neck here. So to the right of the neck, right here. All right? We're going into the trapezius. Base of the neck, above the shoulder there, and the ball goes, ta-da, right in there. Thank you. Go ahead and lay down. There we are. Ball's right in there. My left hand is going to support my head. The ball's in there. Thank you. Gently and easy, please. Take that right arm and maybe just move it around. Oh, yeah. Should be fairly self-evident what we're doing here. We're releasing quite deeply into the trapezius, just adjacent to our neck on the right side. Inhale and exhale. No really, really specific motions are required. Go ahead and rotate the other direction. Yes. Do what you need to do to untighten that specific area. You can imagine that there are many knots, quote unquote, there are many adhesions, there are many restrictions, there are many things that you'd like to change about that area. Go ahead and do that now. Awesome. Thank you. Maybe more interesting would be to take this right arm straight down and then up behind you. Yeah, many people will find that quite a challenge. Inhale and exhale. Inhale and exhale. Beautiful. Another little addition you can do is to actually look away from the ball. Turn your left ear down as you take your hand forward and back, and you'll be able to explore even more of that area. Inhale and exhale, please. Inhale and exhale. Beautiful. Just another 5, 4, 3, 2, and 1. Listen to me if you would. Keep that ball just adjacent to your neck at the trapezius. Now take the hands to the floor. Go ahead and lift up the bum. Oh, you can feel quite a bit of pressure right in there. Maybe, if it's okay with you, you can lift your head for a second and really feel it, and then put it back down. Do me a favor now and just kind of make some circles, draw some circles with the ball into that stripe, into that tight trapezius area, right? So I'm just circling right here for 5, 4, 3, 2, other direction please, circling, 5, oh yeah, 4, 3, 2, and 1. Okay, what I'd like you to do is find a very interesting area that's quite tight, and then lower the bum, relax the arm, and relax right there. It's very easy to get into a position where you feel like you're pinching the nerve. That's not where you want to be. You want to be on the edge of that. You want to feel like, oh, I'm getting close to something like that. But you want to be in a place where you can relax it. I find that when I get a really badly sort of pinched nerve sensation, there's no letting it go. So if you get into that position, it's really frustrating because you can't let it go. You can't possibly. All right? So get into a place where you can actually make a change, breathe into it and relax into it, inhale and exhale. And if you were listening to the radio or if you were doing something else, maybe you want to put that down for a second so you can pay attention enough to make that change. And then once you're on your way, then you can go back to the book you're reading if you happen to be practicing like that. Okay? 7, 6, 5, 4, 3, 2, and 1. Thank you. Gently roll to the side, take that ball out. Magic, right? It feels so good. And it's not even, well, it's not dangerous, and it's not even that hard to do. We just need to have a ball kicking around, right? Second side. So the ball's going to go to the left of the base of our spine. Thank you. Just under trapezius, right there. There's lots of muscle to fiddle with. There's lots of opportunities there. Go ahead and lay down on your back. Oh, yeah. Inhale and exhale. Okay, go ahead and release that left arm, circling it, moving it around. Don't even worry about the precision yet. Just feel like you're able to affect that trapezius structure. Inhale and exhale as best you can. Feel how mobilizing the shoulder is giving you the opportunity to let go of that tension. Inhale and exhale. Inhale and exhale. Beautiful. Other direction. Inhale and exhale. Inhale and exhale. And again, people are often struck by, why don't I do this more often? Well, why don't you? Because you forget? Well, then maybe you leave the ball around the television or out in the open so you can remind yourself of that. Thank you. 3, 2, 1. If you recall, maybe taking the hand forward and back will do it for you, giving you that little bit more. Maybe turning to the right and letting that right ear come down to the floor will be a beneficial change. Inhale and exhale. Inhale and exhale. Beautiful. 7, 6, 5, 4, 3, 2, and 1. Thank you. Now, if you recall, I'm going to ask you to please place that left hand to the floor and then lift that bum. Oh, wow. Really feeling that that ball is accessing the top of your trapezius. Go ahead now, small circles on the ball. Just give it a couple circles, please. Inhale and exhale. Inhale and exhale. 7, 6, 5, 4, 3, 2, and 1. Perfect. Go ahead and circle the other direction. Inhale and exhale. 7, 6, 5, 4, 3, 2, 1. Excellent, everyone. Gently take the ball out, close your eyes, and just settle to the floor for a second. Inhale and exhale. You can release that left shoulder. Inhale and exhale. Breath out. Big breath in and a big old breath out. Amazing. Thank you so much. Wonderful. What I'd like us to do now is to slowly come up, and we're going to access a different part on our left side. Okay, so previously we were at our neck, and then we're here at the lat. Now we are very lateral here, right? What I'd like us to do is move toward the back. So instead of just being here, I'd like the ball to be really more toward the back. We can do that by laying the ball on the back, on the floor, and getting our back on it. So instead of right here on the edge where our shoulders are stacked, I'd like you to be a little bit more toward the back. Oh. We're going to access an area called the serratus anterior superior, maybe get into the intercostals a little bit. Inhale and exhale. Yeah, it doesn't feel great right away. Big breath in, big breath out. If it's available to you, you can lift up that left arm. Oh yeah, and give it a couple circles there. Ooh. So once again, we are not on the edge here. We're at the back, below the shoulder blade, but quite lateral, quite out to the side. And we're trying to access serratus anterior superior, a little bit more of that. Inhale and exhale. Thank you. You can even maybe take that elbow, bend it, and then lift that elbow. Whoa. 5, 4, 3, 2, 1. Thank you. How about we just rest our hand under there, lift up that right arm, and lay our head back a little bit. Oh yeah. I feel like I'm really getting into that backside area. Feel like your rib cage is able to release a little bit. Feel like a lot of the musculature in that area is able to release. Inhale and exhale. We are still technically into lat and even maybe even traps. It depends because it does go all the way down. But the intention as well is to go even deeper. So I'd like you to soften and let the ball travel a little bit closer to the ribs. Oh yeah. 7, 6, 5, 4, 3, 2, 1. Which, by the way, slowly up, leads me to the discussion regarding some therapists. When therapists are overly aggressive and they push too hard on you, your muscle will immediately guard and they won't allow you to go into the deeper muscles. So finding a therapist that is capable of applying pressure firmly at the beginning and then maintain that sort of steady state so that your muscles relax, that is, in my opinion, a better way to go. So again, we're going to take this ball not just to the side of us, but to the back side. All right? So we're going to go laying down on this ball around the shoulder blade. Oh, there it is for me. Good. Roll over so that your chest is facing the ceiling a little bit. Maybe go ahead and circle through that right arm. Oh yeah, getting so much release and work done there. Inhale and exhale. Inhale and exhale. Thank you. Other direction. Other direction. Thank you. 5, 4, 3, 2. Maybe lay down into it. Take that left arm up. And just work your way in and around that ball, getting the musculature to release. Remembering that if you push too hard, your muscles will go, no, no, no. Your muscles like to be told what to do just about as much as you do, in that they don't like to be told what to do. They like to be invited. They like to be given the opportunity to release, and they'll even work very hard to do so, so long as you give them that chance. Okay? So give your muscles that chance to relax. Inhale and exhale. Feel the muscles in between the ribs are starting to soften, trapezius and latissimus dorsi, and even the deeper muscle By deeper, I mean closer to the bone, closer to the center of the body, serratus anterior superior. All these muscles that are very, very relevant to the upper back, okay? Inhale and exhale. Inhale and exhale. Thank you so much. Just for another 7, 6, 5, 4, 3, 2, 1. Thanks. Don't bother getting up, just make sure that you can see me. We're going to take the ball to the left of the spine, but to the right of the shoulder blade. Basically where the rhomboid is. Okay? So I'd like you to imagine there's your spine, right down the middle. To the left of the spine, but to the right of my shoulder blade, that's where the ball is going to go. Got it? Go ahead and lay down and place that ball to the left of the spine, to the right of the shoulder blade. Maybe take your left hand under your head to support it. Oh, I feel that pressure. Inhale and exhale. Now before we mobilize the left arm, do me a favor, step both feet into the floor and lift up the bum. Wow. And now that ball should be adding quite a bit of sensation, quite a bit of pressure into your back. If the ball is too hard and it's hurting you, please back off. However, if you're getting enough and you're able to release, perfect. Just hang out there for a little bit. Or maybe you can circle a little bit, give yourself a bit of massage. The intention is massage. It is not punishment. It is not tenderization. All right? Circle one way, inhale and exhale, relaxing your neck and your face. And then circle the other way, please. Feel like you're able to release. Inhale and exhale. Inhale and exhale. Thank you. 7, 6, 5, 4, 3, 2, and 1. So now with the ball resting to the left of your spine, to the right of the shoulder blade, into that rhomboid area, maybe supporting your head with that right hand. Lift up that left hand. Wow. Take it to the right and left. Opening it. 7, 6, 5, 4, 3, 2, 1. Thank you, everyone. Big breath in, big breath out. Consider, please, taking that left arm straight, bending at the elbow 90 degrees, and taking that left palm toward the floor and up. 7, 6, 5, 4, 3, 2, 1. You may even want to draw that left hand behind your back. And just relax the knees to the left. Whoa. That's pretty intense. Feel free to modify and skip over any of those sort of things, any of those suggestions that I offer, right? Just because the pepper is on the table, the salt's on the table, the hot sauce is on the table, it doesn't mean you should use them. When I give those variations, you can think of them as condiments. They're just a way of modifying the base posture to your taste. Inhale and exhale, please. And again, if you were reading or doing something, watching TV, this is when you can check out. This is when you can relax. Once you've begun the pattern or the practice of release. If, however, you're still struggling to relax, then you need to pay attention a little bit, okay? Inhale and exhale. The question often is, how long should I stay here? I say, especially when you're beginning out, 0 to 100 seconds, I find that to be a reasonable way of going. However, that's dependent upon your texture, that means how your body feels, the hardness of the ball, and how your body reacts to the pressure. So 0 to 100 seconds is just a very basic guideline for you to have enough time to feel it and gather enough data to figure out what is best for you. If you do it for just for 10 to 30 seconds, that might not be enough. If you do it for 2 minutes, it might be too long. You might damage, right? 0 to 100 seconds, I feel like is a good place to begin. People have gone up to practices and they can do this posture. If you've ever done a yin class, for example, they do this for like 20 minutes, half an hour, right? That's not what I would suggest. I would prefer you not to go there, particularly in the context of this video. All right, inhale and exhale. 7, 6, 5, 4, 3, 2, and 1. Perfect. Gently roll to one side. We're taking the ball now to the right of the spine, to the left of the shoulder blade. All right? So just in the upper mid back here, to the right of the spine, to the left of the shoulder blade, so that you're getting into that sort of cavity right there where the rhomboid is. Allow yourself to go ahead and lay down. Awesome. Big breath in and a big breath out. Now, before we start mobilizing the arm, allow yourself to lift up the bum. Whoa, and really feel that ball. The ball's going to be adding a fair amount of pressure into the ribs, into the musculature system. Allow yourself to really work on releasing there. Don't let it take your breath away. Let yourself feel like you're fighting for your breath for a moment, but then make sure that you're able to catch it. Big breath in, big breath out for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Thank you. Lower the bum, please. Thank you. With that bum down, go ahead and extend that right arm up. Oh, yeah. Take it to the right and to the left. 7, 6, 5, 4, 3, 2, you've got this, and 1. Thank you. Bend that elbow 90 degrees. Drop the palm toward the floor and lift. 7, 6, 5, 4, 3, 2, 1. Awesome. Relax the arm anywhere you'd like to. Consider dropping the knees to the right. Oh, that's pretty intense. Oh, sorry. What I had suggested previously is take this right hand, please, underneath you and take the knees to the right, if that's available to you. If it's too intense, please back off. Big breath in, big breath out. Now, one of the reasons why it's hard to be precise about the muscles that are being involved here is that they don't stop and go here, right? They are blended over top. It's like saying, I want to go to Canada, British Columbia, Vancouver, and then I want to go to Kerrisdale. Okay, that's fairly precise, but I could say any of those things and still get close to that area because they're all just piling on, right? Closer and closer and closer and closer. So when I say, upper thoracic spine, rhomboid, and then which muscle, they blend, they overlap. It's not really that necessary. Now, if I actually have to get to a certain location, a particular address, then maybe that precision is required. But if you're just trying to go to North America, that type of precision is not required, right? Just get into the same country, maybe the correct province, and you'll be okay. But if I start giving you, the street address, too much time is spent trying to find it as opposed to relaxing. Okay? 7, 6, 5, 4, 3, 2, and 1. Wait, don't move. I want you to consider how that ball is to the right of your spine, to the left of the shoulder blade, and then in your mind's eye, in your imagination, I'd like you to imagine drawing that ball and rolling that ball down a few centimeters so that it's below your shoulder blade. So previously, it was at the cavity to the right of the spine, to the left of the shoulder blade, right there. And now I'm going to ask you to roll so that ball is same sort of location, but you're moving it down toward your bum below the level of the shoulder blade. Okay? Oh yeah. Inhale and exhale, lift the bum. Ooh, yes, that should be very interesting. Now instead of rocking left and right with the knees, lift up the bum and now circle with the elbow. Wow. Lots of work right there. Okay, scapular stabilizers are there, lots of other little lots of other interesting little muscles to work on. I'd like you to just let that work happen. Inhale and exhale, circle through that arm. Good, and then circle the other way, please. Big breath in and a big breath out. Big breath in and a big breath out. Amazing. 7, 6, 5, 4, 3, 2, and 1. Wonderful. Allow yourself, please, to go ahead and lower that bum. Thank you. Now, I like to take my arm out to the side and drop my knees down. Oh, and I get a bit of back bend. I get lots of nice little bits of work just adjacent to my spine, to the right of my spine, just below the level of my scapular blade. Hopefully you can feel that. And now, I'd like you to feel it. So this is where you put your book down and you ask yourself, what is it that I'm feeling? A lot of times people are going to experience this in different ways. Sometimes people will feel, oh, I can breathe better, or I can breathe worse. Oh, I feel tingling in my nose, in my face, in my stomach. You know, there's so many different presentations of this type of work. So allow yourself to just honestly evaluate what's happening in your body. Inhale and exhale. The 0 to 100 seconds applies again if you're practicing on your own. I'm keeping you within that range, by the way. I'm always cognizant of that. But just allow yourself to honestly take note of where and what's happening. Keeping your breath, please. Big breath in and a big breath out. Big breath in and a big breath out. Lovely. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Roll to one side, take that arm out, and relax down. Beautiful. Now we've already done the rhomboid to the left of the spine. So what we're going to do now is we're going to move the ball just below the shoulder blade to the left of the spine. So to the left of the spine, to the right of the shoulder blade, but just below it. Okay? Go ahead and take that ball right in there. Big breath in. Big breath out. Oh, there it is. Good. Lift up the bum, and if you recall, I'm asking you now to circle through this left arm. Wow, I really feel it there. Inhale and exhale, please. Feel like you're able to mobilize that little bit there, right adjacent to the spine, below the shoulder blade. 5, 4, 3, keep that bum up, 2, and 1. Other direction, please. Circle around in there. Yeah, perfect. Inhale and exhale. Inhale and exhale. 5, 4, 3, 2, and 1. Lower the bum, please. Thank you. Again, I'm going to let my hand drop out. I'm going to drop my knees toward that area. And I'm going to breathe and find whatever it is I need to relax that structure. Inhale and exhale. Now, since we're so adjacent to the spine, we're talking about erector spinae, maybe even multifidi and rotaries. Again, those are the street addresses that I'm talking about. But they're definitely involved, right? Just allow yourself to realize you don't need to know the exact street addresses, right? What you need to do is just get the whole area to relax. Inhale and exhale, please. If you're doing surgery or if you're, technically required to know those things, then yes, please do. But not at this time. I don't think it's valuable in the context of therapy or training or practice like this. Just allow yourself to inhale and exhale and relax your freaking shoulder and back. You might also notice again that this will transmit into your low back, into your hips, to your toes, your face, your nose. I don't know. Allow yourself to grow curious enough and open enough to allow those occurrences to be noticed and maybe even appreciated. Inhale and exhale. Inhale and exhale. Amazing. Thank you. 7, 6, 5, 4, 3, 2, and 1. Take the ball out and relax. And just feel how your upper back, hopefully as well as your neck, is much more willing to, it's much more capable of relaxing toward the floor in comfort. Okay? Great job. We're going to continue our journey down the spine, and we're going to find a location. It's not hard, don't worry about it. I'd like you to notice your solar plexus. So that's where the sternum is, and then there's a split. And then on the right side, take your fingertips, please, and run your fingers and trace the bottom rib, the lowest rib. And you'll notice that it then gets into your spine somewhere just above your belly button. So notice where the lowest rib attaches to your spine behind you. Okay? That's where I'd like you to take the ball. So take that ball to the right of your spine, just below where the lowest rib attaches to the spine. And then go ahead and lay down, okay? So just go ahead and lay down. Huh, interesting. Big breath in, big breath out. Now, depending upon the ball you have, you may feel comfortable lifting up the bum a little bit and rolling around a little bit on it. If that's too intense, then just back off and notice. Perfect. Inhale and exhale. However, most everyone should be able to lift up that knee, yeah, and circle that knee. Perfect. Big breath in, big breath out. 7, 6, 5, 4, 3, 2, and 1. Circle that knee the other direction, please. 7, 6, 5, 4, 3, 2, and 1. Perfect. Inhale and exhale. Do me a favor. Hug that right knee in toward your spine. All right. So right toward your shoulder, please. And lengthen through that left leg. Ha. And then you can actually roll left and right and feel how that ball, oh yeah, can hopefully gainfully release the spine at that level. Just below your rib cage. Just above the belly button, probably. Inhale and exhale. Inhale and exhale. Thank you. Thank you. Thank you. Perfect. Just soften there and let it happen. You'll notice that if you lengthen your leg and the ball's there, you don't really feel anything. That's why I'm asking you to hug that knee in, so that you have enough sensation. If, however, you can feel enough with the ball right there, go for it. Great. It depends again on your anatomy and texture of the ball, etc., etc. Thanks, everyone. Gently roll to one side, take the ball out, maybe give that right knee some love. Thank you. And then once again, if you don't mind, locate the sternum, solar plexus where the ribs separate, trace down the left side where the ribs are, and notice where the left rib attaches, the lowest rib on the left side attaches to the spine. Take the ball just inferior, just below that lowest rib, and to the left of the spine, and let the ball be there. Got it? Thank you. Allow yourself to then inhale and exhale. Maybe lift up the bum a little bit. Oh yeah. And you can roll left and right and feel that work. Wow. Really feel that tight, musculature near the spine is being given the chance to let go. You don't have to twang it. Because the cord, the erector spinae is so tight, you can literally almost twang. You don't need to pluck it, but you do need to stimulate it enough to give it an opportunity to relax. And that's what we're hoping for right now. Inhale and exhale. Inhale and exhale. Beautiful. 7, 6, 5, 4, 3, 2, and 1. Settle your back and bum to the floor, but then hug that left knee up toward that left shoulder. Hug it in, hug it in, hug it in. Lengthen that right leg straight. Perfect. Don't be sitting up. I'm just doing it so that you can see me in the camera, okay? You're laying down with the ball at your back. Big breath in, big breath out. Now, immediately, I'm hoping you're understanding why we don't use a golf ball or a hard ball. It's going to feel like it's going to puncture that area, and it very well could if you apply these types of pressures. That's why the ball needs to be the correct texture. And that's why there is no correct ball, i.e. one ball to rule them all, because everybody is a different texture. And unfortunately, everybody's a different texture on different days, right? So, yes, I have a hard ball, a softer ball, this ball or that ball, or sometimes I just get bored and I get another ball. Don't be afraid of experimenting with your balls. I had a student once, and she had 10 yoga mats. She wanted to have the right mat for the right class. This teacher does this more often than not, so I'm going to use this mat. I go to hot with this one, I go to this one. You don't need that many mats. You don't need that type of specificity. You just need a much more open mind and maybe work on dropping your anxiety a little bit. However, I will say that having the right ball that lets you get there is very useful. So please make sure that you have an open mind, but do understand that the ball does kind of matter, at least a little bit. Inhale and exhale, please. Beautiful. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Amazing, everyone. Gently and easy, please roll to one side, take the ball out, and relax your legs long, and feel how your spine and your shoulders are reacting to that work. It should be really quite lovely. Thank you so very much. Inhale and exhale. Inhale and exhale. Now, we're at an impasse. Do we go along through the bum and go through the glutes more? Do we go through the low back more? Not today. Unfortunately, not today. I promise you, in our next class, we will, but not today. Instead, what I'd like you to do is to gently take that ball, perhaps, just to the nape of your neck, below the occipital ridge, and just relax your head there. Close your eyes and breathe. And I'll tell you a story. I'll tell you a story of when I was teaching in a large studio, and Sean Korn was in my class. If you know who Sean Korn is, she's one of the large yoga figures, one of the luminaries. And she and her partner were there, and she was a little confused. She goes, I thought this was going to be a restorative class, but you're more of a technical fascia guy or a rehab guy. And I said, absolutely. But I find, in my experience, that I can't relax like I would in a restorative class if I have these restrictions, if I have these pains. It's like trying to relax while the house is on fire. It's like trying to relax while I'm bleeding out. I feel like I need to do something to address them first, and then after I address them, I'm able to relax further. Thank you, everyone. Gently turn your head to the left and relax there. And we had that conversation, and I was really happy to express that to her. She goes, no, I get it. I get it. It's just very unique. I don't normally see it. She was talking about how restorative classes are always very gentle and there's nothing that really happens. My problem is again, that if I'm told to do nothing, I have this expectation that nothing's going to happen. However, if I'm given this opportunity to maybe make a small tweak and change and then rest into it, then I'm far more likely to rest. And that's a little bit more of the methodology and technique that I use with you. Thanks, everyone. Turn your head the other way. Let the ball come to the other occipital ridge and relax there. So when I ask you guys to relax, as I will in just a second, I believe, in my experience, teaching over 25 years to literally hundreds of thousands, this is documented, right, of students, people are better able to relax after they make an accomplishment. After they're able to make a shift or a discovery, after they practice a little bit, people are able to relax because they feel, good, now I've done something, maybe I can release into it a bit more. And I try to remind people, thanks everyone, take that ball out, just relax on your back now, that in order to fully benefit, in order to maximize the benefit from your work, often it's not doing more once you've done something, it's doing less and waiting and allowing those changes to occur. Okay? Inhale and exhale. Close your eyes and breathe. Beautiful. Inhale and exhale. Inhale and exhale. Take a moment now, as you inhale through the nose and exhale through the mouth, let your shoulders, while they're on the floor, slide away from your ears. Feel like your chest is opening. Feel like your shoulders are more grounded on the floor. Notice how your neck is a little bit more open. You see, when we address the trapezius, our neck improves. And notice how maybe, just maybe, with the release of your upper back and your neck, your breath or your breathing is a little bit easier. Isn't it relaxing when you can breathe easier? The other day I went with my son and we went up to the Sea to Sky gondola. And it was awesome. Not just for the sight, but for the air itself. I said, hey, do you smell that? He said, what? I don't smell anything. And I said, of course, exactly. And it wasn't just that there was nothing to smell. I felt like the air was easier to take in. Maybe it had more to do with the pressure. Maybe it was the beautiful sight. Maybe it was just being with my son. But the point is that being able to breathe is very relaxing. And I'm hoping that you'll be able to leverage that ease in breathing that you've accomplished right now, hopefully, and help it to relax you further. Inhale and exhale, please. Notice how we were lucky enough not to have to stop just at the neck level, that the ball work that we did traveled down to between our shoulder blades, into the upper middle back, where we're often very cranky with our shoulders and our mousing and our work. Today, notice how we addressed multiple areas, the outside as well as the inside, and how this upper back and these shoulders and the shoulder girdle might have a little bit more work in them in the best of ways. So with this mobilization, with the release of your upper back and shoulders, does that help you to relax a bit more? Are you starting to see the point that I was trying to make with Sean Corn? That by addressing a little bit at the beginning of the class and doing a little bit of work really helps us sink into relaxation. Just like right now, if I ask you at the beginning of the class to relax, maybe you can because you've practiced it, maybe because a lot of you trust me or what have you. But by doing this work first, generally, it's a lot easier to relax.